My name is Dylan Bushel. My project is on food safety, etiquette, and social determinants. Foodborne illnesses have existed as long as man has been eating. Hunters and gatherers most likely consumed toxins from raw meat and ate poisonous plants. The discovery of fire most likely made meat healthier for early man. At any rate, foodborne illnesses exist in every country, state, and community. Not only do foodborne illnesses cause suffering and death, they are a significant economic burden for countries. Inequalities exist among populations. Introduction. Worldwide, there are 31 known contaminants that cause most food illnesses. It is estimated that 1 out of 10 people will get sick from a contaminant each year. In 2010, there were 600 million illnesses, 420 million deaths, and 40% of them were children under the age of 5. As for the United States, we have one of the safest food systems in the world, but we still have huge problems. Statistics vary because not all illnesses are reported, nor do they track all reported cases. In 2017, there were 48 million foodborne illnesses reported. A lot of foodborne illnesses go unreported. A food hazard has any biological, chemical, or physical property that could cause food to be unsafe to eat. There are 5 primary risk factors to contribute to foodborne illnesses. Food from unsafe sources, such as food from other countries with less restrictions or regulations regarding food safety, inadequate cooking, not fully cooking meat, improper holding temperatures, which is under-refrigerated or leaving food out on the counter overnight, contaminated processing equipment, dirty equipment, or the transfer of cleaning products, and poor personal hygiene, not washing your hands before preparing food or meat, or not washing the food off itself. Contaminated foods are separated into 3 categories: biological, chemical, and physical. I can briefly explain each of the differences. Biological contaminants are pathogens such as bacteria, viruses, and fungi. They are microbes that are on our bodies, surfaces, and food. That is why it is important to wash your hands before preparing food or wash raw vegetables before eating them. You cannot see or smell microbes in the food. Chemical contaminants can be separated into 2 categories: chemicals, such as cleaners and pesticides, or toxic metals, such as copper, zinc, and lead. Unlike biological contaminants, you can sometimes smell or taste the chemicals in the food or water. Physical contaminants. This would be any foreign matter like dirt, glass, or bones, usually unintentionally transferred into the food. You may be able to see it in your food. Adequate and social determinants in food safety. Illnesses caused by contaminant food are not equally distributed. Although anyone can get sick from bad food, minorities and poor populations get sick more often from bad food. I'll talk about a few of these problems right now. First, sometimes different ethnic groups eat differently than average Caucasians. For example, many African Americans eat a dish called chitterling, which is a pork product, so they have a greater risk of consuming the germ uracine. Or Hispanic populations eat a lot of Mexican-style cheese, and they have a greater chance of consuming the germ Listerine. Income levels among minorities tend to be lower than the average Caucasian. However, people in poverty, eating healthy is a lot less important than eating, period. They tend to eat whatever is available at the time. Also, sometimes living in environments with the source of contamination. Poor countries or communities are sometimes already infested with rats or pests and other unsanitary conditions. In today's world, family structures are different, and it too has impacted food safety. Single mothers or one-parent households eat differently. Single-parent families eat out at fast foods and restaurants more often, which puts them at a higher risk of picking up a bug from an unsanitary handling of food. Children and citizens are more likely to become sick with a foodborne illness because of their immune systems are compromised. And wealthy versus poor, the wealthiest people are more likely to buy organic, whereas the poorest people are just grateful to be eating. Solutions for all people, including high-risk populations. Most foodborne illnesses are caused by bacterial, virus, or fungi. Education is our first defense. Everyone from growers to consumers need to be educated on the causes and solutions for making food safe. That means farmers have to follow regulations, producers and manufacturers need to use sanitary handling guidelines, and consumers need to prepare the food properly. There are national and international campaigns and partnerships to help educate, such as the World Health Organization and the Partnership for Food Safety and Education in the United States. HACCP, which stands for Hazard Analyst Critical Control Points, is a preventative food safety system that tries to reduce the risk of hazards getting into the food products to an acceptable level. It does not eliminate all risks together. The Food and Drug Administration, or the FDA, and the United States Department of Agriculture, or the USDA, work together to ensure that food is safe here in the United States. USDA is responsible for all meat, poultry, and eggs. The FDA is responsible for all other products. It seems like the U.S. has it all figured out. However, there are many disparities in our system. For example, the USDA inspects poultry and meat plants daily and are on site during any slaughtering of animals, whereas the FDA may not inspect a manufacturer but once in 10 years. The Food Safety Modernization Act signed by President Obama in 2011 was designed to close the gaps between two programs. Science is another food safety solution. Because science, we know so much about biological and chemical factors in the food safety. Scientific and technology advancements include things like radiation treatments to kill bacteria and parasites in the meat and plant foods. Now, the word radiation scares most people. However, 40 years of research, it has shown to be effective and safe. DNA studies are little more recent, but offering a lot of information on the food safety. As far as solutions for inequalities that exist, where poverty exists, so does poor health. There is a strong connection between race and poverty. One of the solutions to solve inequalities that exist in foodborne diseases is to look at solving poverty, because poverty-stricken people tend to be unhealthier. Poverty is complicated. There are a lot of reasons and factors involved in poverty. One factor is no more important than the others. One factor involves prejudice attitudes. Even in the 21st century, some people view others as inferiors. And unfortunately, that is probably not going to change much. So what can be done? The barriers need to be eliminated. Financial barriers include things like low income, affordable housing, college education opportunities, and quality health care. People need to be treated fairly and given the same opportunity. In closing, as a side note on poverty, there is a real connection between hunger and health. The National Commission on Hunger in the United States states that $100 million is spent on hunger programs. There are 15 programs with 61,000 agencies, anything from food pantries to food stamps. 37 million people will suffer from hunger in a given year. Out of those, 14 million people will be children and 3 million people will be seniors. Lastly, here's my reference page. I hope you guys enjoyed my presentation.